And we're with Lauren again, and first, before we do any exercise, you want to warm up. You want to make sure that the muscles are getting blood and nutrients. So one great warm-up is called slinging water or bang the gong, which you're just kind of moving and twisting and loosening up, trying to stay loose in the arms. Separate your legs a little bit as you go. And again, you can go a little further and as much as your knees will tolerate. But really just arms loose, or you can just walk in place. Anything to get your muscles the oxygen and the nutrients that they need from blood pumping. Great. We're going to go now into some postural exercises. The postural exercises are to help correct the most common faulty posture in North America, which is the forward head tilt, where your head walks in 5 minutes before the rest of your body when you walk in the room posture, I call it. So this is called the posture angel. Number one, Lauren's feet are 1 foot length away from the wall. So she stepped out 1 foot. She separated her feet about a shoulder's distance. What Lauren is doing now is pulling her head to the back of the wall, or the back of her head to the wall. And also you'll see her pulling her pelvis in, and her back is flat, so her whole back is up against the wall. If this looks easy, it's not. It's very strainful. And the next part of this is of the angel is to move the arms in circular motions. So we're doing that kind of motion, and there you go, trying to breathe in and out as we go. A little bit more of a motion up and down in circles. That's it, Lauren. That's perfect. And Lauren is keeping her arms against the wall, and this is very difficult to do, but this helps improve posture greatly. Okay, if Lauren is at a desk for any amount of time, her forward head tilt, if you look where Lauren's ear is in relation to her shoulder, her ear should be over her shoulder, and as you can see, it is way forward. So a good recommendation is if you're at your desk, every 15 minutes for 5 seconds. So every 15 minutes you got to just get yourself a timer, or just mentally time yourself. Lauren's going to pull her chin to the back of her neck, and then she's going to look up at the ceiling. 1, 2, 3, 4, 5, relax. And again, every 15 minutes for 5 seconds, she's going to pull back, look up at the ceiling. 1, 2, 3, 4, 5, and then perhaps do some shoulder shrugs one way and then shoulder shrugs the other way, and that will stop any repetitive action injury from occurring.